Today I'm joined by Claudia Ferreira, acupuncturist, Chinese medicine practitioner and founder of Body Perfected, a holistic therapy clinic in the UK. So what is acupuncture? What can it be used to treat, and is it painful? What's lymphatic drainage, and when should you be getting this kind of massage? In this conversation, we chat about the traditional lack of care in Western medicine for women following a miscarriage and how she's trying to change this. We also discuss the many uses of Chinese medicine in infertility. Let's get into it. Claudia, thank you so much for joining me. I know it's morning time for you and it's evening time for us, but thank you for joining me on the podcast.
Pleasure to be here. Thanks for reaching out. It's a new experience for me, so I'd love to to break the ice, if you'd like.
Claudia, I'd love you to talk to our listeners and tell them a little bit about who you are and what you do and where you're based.
Yes. So I'm originally from Brazil and I'm based in London. I've lived in London for the last 25 years. And I moved here to study Chinese medicine, to go to university here, because there were no accredited courses back in the days in Brazil. I was a competitive swimmer, and I used to have massages and acupuncture done for my all of my injuries. And so that's how I became interested in it. And I have a thriving practice here, smack bang in the center of London, in Marylebone.
That's so interesting. So obviously we come from quite different disciplines and backgrounds, but so tell me a little bit about Chinese medicine and what the philosophy and thinking with Chinese medicine is.
It's a comprehensive system healthcare, and it is very much practiced in China as a dual modality. Which means that doctors are also Chinese medicine practitioners, and increasingly Chinese medicine practitioners have to have some knowledge of biomedicine. And it is very much, I think nowadays, the marriage of these two modalities that are is more effective to practice. But it is an ancient practice based on the philosophy of the Tao and principles of Qi. Qi is the vital energy that is it's the life force behind every living thing and behind energy, because energy is in movement. It's always in movement, and it must be. So it's based on the Qi, it's based on the 5 elements, metal, fire, water, earth, wood. And this is like our connection to the outside nature world. It bridges this connection between the human body and earth, basically, and nature. These are the principles, the principle of yin and yang, the duality. Duality means that for everything that exists, there must be an opposite force to it in order for it to exist, right? So otherwise it wouldn't. So for every disease in Chinese medicine, there must be a natural component coming from earth that is the cure for this disease. You see, so these are the principles of Chinese medicine.
Okay, and when you
it's beautiful.
Yeah, it sounds amazing. And when you study Chinese medicine, do you still study like anatomy and the body in that form?
Yes, 100%, because we have to locate the points within the body. And these are the Zhang, what we call it the Zhang Fu, the energy pathways that run within our bodies. So in order to locate the points, we have to know exactly where they sit anatomically in terms of like translating the energetics of their functions into what happens physiologically in the body. So yes, of course we do.
And I know that acupuncture is a big part of your practice. What is acupuncture? And sometimes people will describe it colloquially as having pins stuck in you, and they think it's going to be painful. Can you take us back to real basics and explain to us what it involves and why it's a practice that's followed?
So acupuncture is one of the many modalities of Chinese medicine. We have acupuncture, we have herbal medicine, formulas based on just natural ingredients coming from the earth, as opposed to lab-made auto-twinner, which is a form of massage, etc. But acupuncture is the practice of inserting needles in particular energy points located within the energetic pathways in the body. That's what we call it Zhang Fu. And each of these pathways are connected to an internal organ. So we've got the liver, the gallbladder, stomach channel, the bladder channel running on the back of the body. And there are various points that corresponds to, how can I put it? The function that there are the functions of the pathways. There are the functions of the channels, and there are the functions of the points within that channel, and the force that they have. And for instance, what they do. There are some points on, I'll give you an example. There are some points on the stomach channel that are cooling points. And there are some points on the liver channel that are cooling points. And there are other points on these channels that are more warming and moving points. So you choose accordingly to what the patient is presenting, which one to use. There are points to induce labor, for instance, on the bladder channel. These are like very moving points.
Can I ask, why would you want to use a cooling point or a warming point, like for example on someone's stomach? Why would you choose one or the other?
Absolutely. So for instance, if I am seeing, which I do a lot, a woman that comes presenting with a cold uterus, and that is linked to hormonal imbalances, menstrual issues, like for instance, dysmenorrhea, woman that hasn't had a period for a long time, then I am looking at what is causing this stagnation in the uterus. And oftentimes, it is caused by what we call it a cold uterus. A cold uterus because someone may be consuming a lot of cold foods, cold drinks, because of the influences of cold and damp weather outside. What else could be influencing a cold uterus? Cold feet on the floor when you first get up in the morning, because that stagnates the channel, the kidney channels, and the liver channels rising up to the uterus. So on this case, I would use points to warm up the lower triple burner, which is another Chinese medicine sort of organ that is located on the stomach. So we have the upper burner is the upper part of the stomach, the stomach and sort of heart, and the middle is again the stomach and the intestines, and the lower is more like the genitals. So that's in short how I would choose, as opposed to, for instance, if someone is suffering from digestive systems and they're getting a lot of heartburn, we know that this is associated with heat. So then we use points that would cool off the stomach.
And how many treatments would someone need to have before they noticed a difference?
Yeah, that's very, very, very individualized and based not only on the person, but on the condition. For instance, if I am treating an acute injury, a neck pain that has locked because a person slept in a funny position, they've come to me, they can't turn the head, then I would say 2 to 3 sessions, sort of like back to back, not every 2 to 3 days, and this problem would be sorted. If I am seeing someone with hormonal imbalances and, no menstruation or a lot of pain, a lot of stagnation within the blood, then that's a completely different protocol. Usually for hormonal issues and menstrual issues, I would want to see a woman for a minimum of 2 cycles. So that's 8 sessions once a week. So we can try and regulate the cycle then. But again, it really depends. The more chronic the condition, the longer they've had it, the more treatment they will need, and longer, the longer the treatment protocol will be. And make no mistake, with acupuncture and natural, alternative medicine, so we call it, I don't like the terminology, but natural treatments, they have an accumulative effect. So the more you commit to the treatments, the better the outcome will be. Also, very important with acupuncture, because sometimes patients come seeking help, but they don't realize that the duration and the frequency of treatment is a extremely important component for the outcome, for the success. If you're coming to me with menstrual issues and you are not committing to those weekly sessions regularly, that ties in with before your ovulation and before you get your period, if you miss these dates, it most likely it's not going to work. That doesn't mean that it won't, but it could very well not. And then acupuncture gets a bad name. Oh, it didn't work for you. Yeah, but you missed this date and you randomly booked your appointment. No, we must tie in with your internal cycle. You see, it's very individualized.
And Claudia, obviously Chinese medicine has been around for, well, thousands of years. And I know that China is prolific in the amount of research that they publish, certainly in sort of Western style medicine. Is there much research or proof?
There are so many. Now, in terms of proof, most of the studies conducted and the ones that have most credibility are the randomized controlled trials, which uses placebo as a measuring component. And there is a challenge with this because Chinese medicine is individual to the person. So we are not treating headaches. We're not treating infertility. I am treating the person. You see, so this is why the studies are very controversial in their findings. They always question the credibility of it because of the nature of the study. But the World Health Organization, if you go into their site, they recognize Chinese medicine, herbal, and acupuncture as a credible treatment for 43 different health conditions, including allergic rhinitis, depression, dysmenorrhea, the absence of period, headache, hypertension, knee pain, lower back pain, morning sickness, osteoarthritis, stroke, tennis elbow, sciatica. There are cited within the World Health Organization having Chinese medicine as a credible treatment for these conditions. And in terms of papers, yes, there have been so many. You can find them in PubMed, but they use more an observational protocol rather than placebo. You see, they would then perform the treatment. They would take a group of people and perform the treatment. For instance, for IVF. There has been studies done on acupuncture supporting IVF, and 60% of the people receiving they have a 60% success. So people receiving acupuncture had a 60% more success than the ones that weren't receiving acupuncture together with IVF. Yes, this is, there is a study on it. Yeah.
So I know that fertility or infertility are both big interests of yours. So how do you approach that with your patients?
Yes, it's very much treating fertility naturally is very much a puzzle. And it is, in my practice, also conducted. I would want to see biomedicine exams and results, scans, blood tests, spermogram, and it's a bit challenging to approach the doctors because they're not very responsive a lot of the times. But if the client is willing to share, most of the time that they are, then we combine the knowledge that we have from these tests with piecing the pieces of the puzzle together with our philosophy. And lifestyle plays a major factor in treating fertility, and also stress, isn't it? Because acupuncture down regulates the central nervous system, and it induces the production of healing hormones such as endorphins and anti-inflammatory hormones that help, with all sorts of conditions, and this includes fertility itself. So the approach is very much dual, with integrating traditional Chinese medicine with biomedicine. And I've had great success with it. Also, we guide patients into fertility awareness, because I find that oftentimes people are kind of lost. They don't know where to go, especially here in the UK, because women are not treated by gynecologists. And I think this is a real issue. I think this is something that really needs to change here. I think that women need to be seen from early age by gynecologists, not by general physicians. We have a very, very unique physiology. So it differs completely from male. It has to be tailored to us. The treatments that we get from doctors, it has to be tied in with our hormones and menstrual cycles, because we live governed by them, by our hormones. We are totally governed by them, and we have to be more in tune and aware of when they are released, what they do to us. For instance, on our luteal phase, just before we get our periods, we become completely emotional, and it's the release of progesterone. We're irritable, we're tired. Oftentimes, we're shouting, and it's like, oh my God, you think you're depressed, and then your period comes, and you're like, oh, feels so much better. I'm not going crazy after all.
Claudia, what's the Chinese medicine philosophy around infertility? Is the philosophy around energy, or is there a thinking behind what might be the cause of fertility issues?
In short, the uterus is like it's a really important vessel, and there is two aspects around infertility. that we look at for women. For us, Chinese medicine practitioners, we need to be looking at if the woman is deficient, if her blood is deficient, so if she's lacking nutrients, for instance, or for instance a slow hypothyroidism. This is tied into deficiency and what we call it blood stasis in the uterus. So deficiency, which is vacuity, either blood or thyroid, or blood stasis in the uterus. What does blood stasis in the uterus mean? And I see a lot here in the clinic. It could mean uterine polyps, fibroids, blocked fallopian tubes. These are linked and associated with blood stasis in the uterus. Oftentimes, women come to me not knowing that they have fibroids because of the symptoms and the tongue and how we diagnose. So we feel for the pulse, we look at the tongue, and we ask a lot of questions about their menstrual cycles, including the quality of the blood, if there are blood clots, if the blood is brown just before they start the period. When we get the answer to these questions, then we can kind of diagnose it. And a lot of times there's a cross pattern as well with deficiency and blood stasis in the uterus and so forth. We can treat blood stasis in the uterus with herbs. There are herbal remedies that reduces fibroids. Another condition is polycystic ovaries. This
That's a big one.
This is considered as a blood stasis in the uterus.
I was going to ask you, I noticed on your website and about miscarriage and treatment of women after miscarriage, and I do genuinely believe that in tradition or Western medicine, we're probably not great at that. I think, you obviously, if I like to think that I'm a very compassionate GP, and I've been through that myself, so I do know it's very, very upsetting, but I feel like we're quite medicalized about, treating it or performing surgery if that's required, but then women are kind of just sent off to, and
completely. There is no emotional care whatsoever, and not even lifestyle advices afterwards. None of it. That's it. Done. We've performed this procedure. Off you go. And this is what we need to kind of bring more out to the world. It's the awareness of what we go through.
I think a lot of women are also left after a miscarriage quite unsure, like, can they get pregnant again straight away? How long should they wait? And I just was interested to understand what the sort of traditional Chinese medicine philosophy would be on, care after miscarriage.
Well, my care is to provide not only emotional support, but support for the trauma that the body has just gone through. To process the hormones, because all of a sudden you're pregnant. One day you're pregnant, the other day you're not. And not only you're dealing with the grief of the loss, you're also dealing with the pregnancy hormones still in your body. So it can be very confusing. This is where I come in and I offer a combination of acupuncture and lymphatic drainage. And also herbs to repair and tonify the blood after that because of the loss, because of the blood loss, and so forth. So yes, it's very nurturing.
Yeah, absolutely.
It's a very nurturing protocol.
Yeah,
and very important.
Yeah, it sounds lovely, and I really love that philosophy. I want to switch pace a little bit if I can. And talk a little bit about some of the other treatments that you do, like lymphatic drainage massage. Can you explain that to me and what you're trying to achieve and what the thinking behind that treatment is?
Sure. So lymphatic drainage, I offer treatment for different ailments. For instance, post-op, if you've had surgery for even injuries. I had someone that came to me with a broken ankle, and they were looking to get to heal quicker because they were running the marathon. So we did the lymphatic around the ankle to reduce the swelling. So that's one thing. MSK. I do a lot of lymphatic and visceral manipulation for gut health and for fertility as well. So if there is a lot of inflammation on the tummy, there will be swelling and water retention. And this treatment is great. It's a great treatment for it to drain the excess fluids and to reduce inflammation. And indeed, for women who suffer, as we all do, our weight fluctuates around the month. Tied into our hormones. For instance, on our luteal phase, just before the period, we tend to retain water and put on a little bit of weight. And this is where lymphatic is a great session as well. So it helps to drain that fluid and shed the excess water. And coupled with acupuncture, it's a blissful treatment because it down-regulates the central nervous system, and it's very calming and soothing, and it moves the energy around as well because irritability is associated with liver qi stagnation. So when the energy gets stuck somewhere, we kind of release it with the needles.
Okay, amazing. And what about patients who've had maybe like breast cancer and who are having, lymphedema of, their arm or hands and things? Is that
lymphedema?
So
yes,
is that something
absolutely, yes, absolutely. I don't do oncology, I must admit. I don't treat patients that are in treatment for cancer, but that's just naturally how my practice is. But yes, lymphedema I have very successfully, but lymphedema is a chronic condition, so they have to adopt this treatment into their lifestyle regularly. It doesn't cure it, but it certainly reduces the swelling. And it improves the quality of their lives with pain and movement, easier movement, etc.
And Claudia, what about, I know that you touched a little bit on stress there, but what about things like mental health problems like depression and anxiety? Is there any place for acupuncture or any of the other treatments that you do?
Oh, absolutely. It's again, you must adopt this into your lifestyle. So it's very much bringing the person back to themselves, promoting this sort of self-awareness with the treatment with the needles. I can't say, oh, this is the treatment plan for depression because it's very much individualized, but we would be treating a lot of heart. We would be doing a lot of heart points, liver points, and we would be looking at the gut health microbiome as well, because it is very much linked to mental health. And these are like recent studies, that are providing us with all of this invaluable information. So yes, I think nowadays practitioners have to have sort of, they have to have like a multitude of knowledge in order to be able to treat. And I think more often than not, most all of the time, I don't just use needles. It's very much a combination of diet, lifestyle, meditation, breathing exercises, all done in the practice.
Claudia, is acupuncture painful?
This is an interesting one because pain is very relative to a person. There are some clients that come and they are just absolutely fine with it. No, it doesn't hurt at all. And there are others that they're very, very nervous. They cannot stand it. It wouldn't be effective for someone who's very nervous about needles and receiving acupuncture. It is not it is not pain. It's not that painful to me. What you feel is a really tiny pinprick, and that's it. I mean, the needles are extremely fine, and they go in beautifully. So couple that with a good needling technique, it's really not painful. But if you are, disposed to already not, having a phobia of needles, I would say that's not the treatment for you. But I think everyone should give it a go and try it.
And Claudia, I know that I'm harping back to research, but has anyone researched to understand how it works or why it works?
More and more we're having studies on atoms and energies and stuff. But I suppose that they're lacking the resources in finding that out for acupuncture. So to my knowledge, no, but maybe there is. And if there is, I don't know. But I can look into it and maybe get back to you on that. So, yes, I mean, to my knowledge, I'm not sure whether there is a studies. And I think if there isn't, it's because we don't have the resources and measuring how energy influences, our physiology, basically. But you have there, for instance, Dr. Joe Dispenza, that is really doing a lot of work with meditation and neuroscience. And that ties in with acupuncture really well, because it is the practice of energy, and us being able to change our physiology through energetics.
Yeah, it's amazing. I work with a GP who does acupuncture, so I definitely believe it works. I've sent some of my patients to him for treatment, but I would just love to try and understand, how does it work? It's maybe going to be one of those mysteries that we'll just have to accept. I was going to ask you, is there anything that you would love?
We are not. We think of ourselves as hard matter, but we are not. We are an accumulation and an agglomeration of energies just vibrating very quickly. So if we think of ourselves that way, then it makes sense that if we work with energy pathways, then we would be able to shift, imbalances within the body.
I have a question for you from my youngest child. He wanted to know, is there points that you can put a needle that are dangerous, or that you definitely shouldn't put an acupuncture needle?
No, you have to be careful. Yes, so you have to be careful around the lungs, so you don't puncture the lungs. It's a common, unfortunately, it's a common thing to. Well, it's not that common, to be honest, but it's the only contraindication are the points that are within the thoracic cavity. The insertion, the perpendicular insertion, has to be somewhat superficial, no more than a 1-inch insertion, to avoid this sort of issue. But apart from that, it's pretty safe.
And in terms of, is there anything that you would love people to understand about Chinese medicine and acupuncture and all these therapies that you offer that perhaps the general population doesn't really understand?
I mean, I'm an advocate for it. I'm so biased, I'm trying to come up with an answer that is not so biased. But I think more and more we need to awaken to the fact that we are made of energy. And this is precisely why Chinese medicine is so effective. So I think just changing the mindset, and also that there are there shouldn't be any quick fixes, if you like, for your health issues. It is very much a journey. It's an inward journey. It's a self-awareness journey, coupled with what the practitioner does. And that so I think the more awareness that we have on this side of life, basically, and it's linked to the energetics of it, then I think the more effective acupuncture could be, or infiltrate. Mm-hmm.
Can you share any de-identified patient stories with us of some of the successes that you've had with patients?
I have had someone that has had multiple miscarriages in the past, and she came to do my program, and it was very much providing her with a lot of awareness to what she should be looking out for. And she's just had a successful pregnancy. She did go through IVF because the NHS suggested that she did. And I very much respected that. So I didn't try to steer her away from having IVF. I said, if this is what the doctors have suggested, and if this is what you feel comfortable, let me support you through this journey. And usually with IVF, the average number of treatments that a woman has before she's successful is 3 cycles of IVF, but the NHS only offers 1. And coupled with my program, with the herbs, with the treatments at the clinic, and lifestyle advice, she was successful with just one treatment, and she has a beautiful baby boy now. She just had it in December, so it's just one of them. But there have been many in the past, like 2 years. There's been 5 successful pregnancies.
Oh, amazing! And in terms of pain, do you feel like acupuncture, obviously there's lots of people struggling with chronic pain and endless cycles?
It releases endorphins. It's an anti-inflammatory protocol. It really is. And it's very good for pain management. Very, very good, especially if it's acute. Again, if it's an acute injury, then you will go through a treatment plan, you will finish that, and off you go. If it's a chronic problem, then you would go through a longer protocol, hopefully with a view of shifting it. But in terms of management and in improving the quality of life of people that live with pain, yes, it's amazing.
So, Claudia, thank you so much. You've been really, really generous with your knowledge and educating me on an aspect of medicine that I know really very little about. So thank you so much. If anyone listening wants to go down the route of, I suppose, first of all, maybe finding a practitioner local to them, are there lots of organizations or associations with that practitioners ascribe to?
The UK, yes, here in the UK, yes, you can reach out to the British Acupuncture Council, and they will have the list of registered practitioners that are registered with them. They're the governing body here for acupuncturists, and they can find practitioners through them, it just, I think, research and word of mouth, really. I like to get referrals. I prefer to have a referral from someone who has seen that person and who has established a good rapport with the practitioner, coupled with, of course, positive results. Then yes, but it's a credible modality to be searching for sure.
And obviously, as I said earlier, we have listeners all around the world, but we have a substantial number here where I'm recording, which is in Australia. If any of our listeners wanted to engage with you, obviously you're across the world, but is there any way that they can engage with you, or how could they contact you or learn a little bit more about you?
They can log into my website, www.bodyperfected.com, and they've got all my details there, or through my social media account, Body Perfected on Instagram, which I post some videos. I'm not a massive social media poster, but there are some interesting videos there, including one that a recent one that I've posted. A doctor took a blood sample of someone that has, before they received acupuncture, and then she took it again after they received the acupuncture. And there's a major difference on the circumference of the cells and how they just moved within the blood, reduced inflammation, better cell circumference, and just a bit more of a harmonious movement. And this was just after a 15 minutes of receiving a combination of points, what we call it, the 4 gates. So that's on my social media account. It's really interesting to see. So they can tap in there and give me a follow, and we can stay connected through there. I'd love to hear from them.
Yeah, amazing. I'm going to go and search for that little video. That sounds amazing. And Claudia, my final question to you is one we ask all of our guests, which is, if you could talk to the 20-something Claudia, what would you tell her from what you've learned in life to this point?
Yes, there's 2 things that I would say to her: that it is not too late. You know, when you're in your 20s, you think you should have started when you were 15 or 18, and it is not too late to start at all. You've got your whole life ahead of you, and there are no quick fixes. It is a journey. It is a commitment, and that's what I would say to my younger self. Be patient with your vision, with your what you imagined your outcome to be, because it's certainly not going to happen within months.
Absolutely, I love that. Claudia, is there anything else that you'd like to share with our audience before we sign off today?
I think we've touched the surface of what is most beautiful and easy to understand for listeners who don't know much about acupuncture, without going into terminologies that would be difficult to understand. I think we've covered, most of it.
Amazing. Thank you so much, Claudia. It's been lovely to talk to you.
Thanks for having me.
You're so welcome. I think you'll agree we've had some incredible guests on the podcast already, and today's was no exception. I think there is so many nuggets of information I'd love to get out there. So if you know someone who would benefit from the podcast, please share it. That way more people can learn all about themselves. Remember, this podcast is all about you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.